In June of 2020, there were concerns about the sensitivity of rapid tests when we learned that some persons who tested negative for COVID-19 abroad using a rapid test prior to entering Belize tested positive for the virus when swabbed at the PGIA with a PCR test.
Patient number 21 and the two other nationals that arrived, we do what test that they did. It does say on the note that we got from them that those have not been cleared by the FDA, but nonetheless, that's what they are doing in the Houston area. One out of those is a false negative. That's one out of three at least.
The issue of sensitivity and sensibility was a primary concern within the Ministry of Health at the time. While there was discussion about introducing the rapid test in Belize, validations first had to take place.
Understand that when you have an epidemic, let's say you go and start doing rapid testing in the people in San Pedro, the positives that come up, that is not a problem. You consider that as a positive case. The problem will happen though when you have a negative result, because then you can have what's called a false negative. So the patient may be told that they are negative, but in point of fact they are positive. So that's what you want to be able to safeguard.
And then in late August, the FDA gave clearance for the Abbott rapid test, which is reportedly 97.1% accurate.
Abbott has said that it will be shipping the tests in the tens of millions next month, right here, September, starting next week.
The Ministry of Health eventually launched rapid testing in August Pine Ridge using the SD Biosensor Rapid Test. The 15 minutes turnaround time was a game changer.
So we identified 6 persons positive, and it was really a great benefit because right away the person was called, and of course we made the validation with the PCR test.
As the number of COVID cases spiraled out of control in 2020, the Ministry of Health's demand for rapid testing increased. With the change of administration came the rollout of rapid testing countrywide.
The plan moving forward includes the immediate implementation and scale-up of the use of rapid tests in all district hospitals with clear testing protocols. All regional and community hospitals are now conducting rapid tests. We shall be expanding test sites throughout the country.
By May of 2021, the number of COVID cases rapidly decreased, in part due to the increased availability of testing. Now, in the midst of a third wave of infections, sensitivity concerns have resurfaced. Concerns about false positives prompted this week's response from the ministry. The release asserts that the SD Biosensor test returns accurate positives 88% of the time.
There will always be comments about the quality and of the different tests, but that is what we have right now to offer the community, so that is better than nothing. So I think we must make much of the opportunity because we have been picking up positive cases. I don't say today, but that is what the Ministry of Health use, and that is what is helping us to identify the cases.
Is it possible that the SD Biosensor antigen test can pick up a false positive result?
Every test is not that, 100%. You always have some level of false positive or false negative, which we call sensitivity and sensibility of the test.
Yes, there may be false negative, there may be false positive, but I think the brand that we're using right now, because we use it at the hospital, has proven to be very effective. And so, yes, it is a very good test to be using.
Reporting for News 5, I am Paul Lopez.